Hospitals are places of healing, havens for the sick and injured. But what happens when this trust is shattered? This is the chilling story of Kristin Gilbert, a nurse who went from being a beacon of hope to a harbinger of death. Her story is a stark reminder that darkness can lurk beneath the surface, even in the most unexpected places. Stay with us as we uncover the truth behind the mask. Kristin Gilbert's reign of terror unfolded within the walls of the Veterans Affairs Medical Center in Northampton, Massachusetts. A pattern of suspicious deaths emerged, sending chills down the spines of her colleagues and raising alarm bells within the hospital. As the body count rose, whispers of Gilbert's involvement grew louder, transforming the once trusted nurse into the prime suspect. This is a story of betrayal, of a healthcare professional who exploited her position for sinister purposes. Gilbert's method was chilling. She would inject patients with lethal doses of epinephrine, causing their hearts to race uncontrollably. The sudden cardiac events often led to fatal outcomes, masked by the chaos of the emergency. Her colleagues were initially oblivious, attributing the deaths to natural causes or unfortunate coincidences. But as the incidents piled up, some began to suspect that these were no mere accidents. The dark truth was slowly coming to light. Gilbert started as a promising healthcare professional. As time went on, a subtle shift occurred in Gilbert's demeanor and behavior. Colleagues noticed that Gilbert seemed to thrive on chaos, often being present when emergencies arose and exhibiting an almost unsettling fascination with death and dying. She would often be the first to respond to codes, her adrenaline seemingly pumping as she participated in resuscitation efforts. While some dismissed this as a harmless, if somewhat morbid interest, others couldn't shake the feeling that something was amiss. Unbeknownst to those around her, Gilbert's dark fantasies were about to bleed into her reality, with terrifying consequences. The whispers among the staff grew louder, as discrepancies in patient records began to surface. Gilbert's colleagues started to connect the dots, realizing that her presence often coincided with unexpected patient deaths. The administration decided to take a closer look, and soon, law enforcement was involved. The investigation would reveal a chilling pattern, one that would shock the community and forever change the hospital. The dark turn in Gilbert's life was now undeniable, and the consequences of her actions would be felt for years to come. The hospital, once a place of healing, had become a scene of horror. The community mourned the loss of innocent lives, and the name Kristin Gilbert would be forever etched in infamy. Kristin Gilbert was born on November 13, 1967, in Fall River, Massachusetts. From a young age, she exhibited intelligence and a keen interest in science. Her academic prowess was evident during her high school years, where she excelled in her studies and was particularly drawn to the sciences. After high school, she attended Bridgewater State College, where she continued to pursue her passion for science and medicine. Graduating with honors, Gilbert's future in the medical field seemed bright and full of promise. Kristin Gilbert's journey into the heart of the medical field began with aspirations of healing and care. She pursued a nursing degree, driven by what seemed at the time to be a genuine desire to help others. Upon graduating, Gilbert secured a position at the Veterans Affairs Medical Center in Northampton, Massachusetts. Her early years at the VA hospital were seemingly unremarkable, with colleagues describing her as a competent and efficient nurse. Kristin's first job at the VA hospital in Northampton marked the beginning of what appeared to be a promising career. She quickly gained a reputation for her efficiency and competence, earning the trust and respect of her colleagues. Her dedication and hard work did not go unnoticed, and she was soon recognized for her contributions to the hospital. However, beneath the surface, a toxic love affair with a hospital security guard began to unravel her facade. The relationship was marked by intense emotions and erratic behavior, leading to escalating chaos within the hospital. Gilbert's actions became increasingly unpredictable, causing alarm among her colleagues and supervisors. The once competent and efficient nurse was now at the center of a storm, with her professional and personal life spiraling out of control. Despite her professional success, there were early signs of trouble. Gilbert's personal life began to interfere with her work, leading to erratic behavior. Her relationship with the hospital security guard was tumultuous, filled with intense emotions and frequent conflicts. As her personal life spiraled out of control, so did her professional conduct. Gilbert began to exploit her position, leading to a series of unexplained patient deaths. As the chaos in her personal life grew, so did the darkness in her professional conduct. Gilbert began to exploit her position, using her access to medications to carry out her deadly intentions. She would administer lethal doses of epinephrine, causing patients to suffer cardiac arrest. The sudden and unexplained deaths raised suspicions, but Gilbert's actions were initially masked by the chaotic environment she helped create. It wasn't until a pattern emerged that the true extent of her deadly method was uncovered, revealing the horrifying reality of the Angel of Death. As suspicions grew, the hospital administration and law enforcement began to close in on Gilbert. Increased surveillance and scrutiny of her actions made it harder for her to continue her deadly practices. Interviews with staff and a thorough review of medical records started to paint a clearer picture of her involvement. Eventually, the evidence against her became overwhelming, leading to her arrest and the end of her reign of terror. Gilbert faced trial, where the full extent of her crimes was laid bare, shocking the community and the nation. The once trusted nurse was now known as the Angel of Death, a chilling reminder of the darkness that can lurk behind a caring facade. The impact of her actions was felt far and wide, leaving a lasting scar on the community and the families of her victims. In the wake of the tragedy, the hospital implemented new safety protocols to prevent such a horror from ever happening again. The medical community took a hard look at its practices, emphasizing the importance of ethics and patient care in the training of new nurses. While the shadow of Kristin Gilbert's actions will forever linger, the lessons learned have strengthened the resolve of those dedicated to healing and care. The investigation into Kristin Gilbert's crimes extended beyond the physical evidence and witness testimonies. It delved into the very essence of her being, seeking to uncover the psychological underpinnings of her actions. To truly understand the depths of her depravity, authorities sought to penetrate the labyrinth of her mind. This journey into her psyche was not just about understanding her motives, but also about comprehending the complex interplay of factors that led her down such a dark path. What drove a seemingly ordinary nurse to become a serial killer, preying on the very patients entrusted to her care? This question haunted investigators and psychologists alike, pushing them to explore every facet of her mental state. To unravel the enigma of Kristin Gilbert, one had to venture into the darkest corners of the human psyche, a realm where compassion and cruelty collide, where the line between sanity and madness blurs. It was a journey fraught with disturbing revelations and unsettling truths. Experts delved into her psychological profile, uncovering a history of manipulative behavior and a need for control. This need for control manifested in various aspects of her life, from her professional conduct to her personal relationships. Her past revealed a pattern of deceit and a disturbing fascination with power over life and death. These traits were not immediately apparent to those around her, as she maintained a facade of normalcy and competence. The chilling realization was that Gilbert's facade of normalcy masked a deeply disturbed individual, driven by a sinister compulsion. This compulsion was not just about causing harm, but about exerting ultimate control over her victims' fates. As investigators pieced together her psychological puzzle, the true horror of her actions came to light, painting a portrait of a nurse whose compassion had turned into a deadly obsession. This obsession was fueled by a complex interplay of psychological factors, including a deep-seated need for validation and a perverse sense of power. The psychological analysis revealed that Gilbert exhibited traits consistent with several personality disorders, including narcissistic and antisocial tendencies. These traits contributed to her ability to manipulate those around her and to carry out her heinous acts without remorse. Her career as a nurse provided her with the perfect cover, allowing her to blend in seamlessly while she carried out her deadly deeds. The trust placed in her by patients and colleagues alike made her actions all the more insidious. The investigation into her psyche also uncovered a history of troubled relationships and emotional instability. These factors, combined with her professional environment, created a perfect storm that led to her becoming one of the most notorious medical serial killers in history. The deeper the investigators delved, the more they realized that Gilbert's actions were not the result of a single moment of madness, but rather a calculated and prolonged descent into darkness. Her ability to maintain her professional demeanor while committing such atrocities was a testament to her deeply fractured psyche. The psychological profile painted a grim picture of a woman whose outward appearance of normalcy was a thin veneer over a chaotic and dangerous mind. It was a mind that thrived on control and manipulation, finding satisfaction in the suffering of others. In the end, the investigation into Kristin Gilbert's psyche provided crucial insights into the mind of a killer. It highlighted the importance of understanding the psychological factors that can drive individuals to commit such heinous acts, and it underscored the need for vigilance in identifying and addressing these factors before they manifest in violence. The case of Kristin Gilbert serves as a chilling reminder of the potential for darkness within the human mind and the importance of psychological analysis in uncovering the truth behind seemingly inexplicable actions. During Gilbert's trial, forensic psychiatrists dissected her psyche. They painted a chilling portrait of a woman driven by psychological factors. Their testimonies provided a glimpse into the mind of a healthcare serial killer. Dr. Park Dietz testified Gilbert exhibited traits of Munchausen syndrome by proxy. She derived gratification from causing harm to her patients. The courtroom was gripped by the revelations. Jurors listened intently as experts detailed her manipulative behavior. Evidence presented in court painted a damning picture. Gilbert's reactions were scrutinized, revealing little remorse. The closing arguments left an indelible mark on all present. The trial was a pivotal moment in understanding the dark side of healthcare. The evidence and testimonies unraveled the enigma of a healthcare serial killer. The judge delivered a guilty verdict, sealing Gilbert's fate. She was sentenced to life in prison without the possibility of parole. The families of the victims felt a sense of justice, though the pain remained. The case drew widespread media attention, highlighting the vulnerabilities in the healthcare system. Gilbert's imprisonment marked the end of a harrowing chapter, but the lessons learned continue to resonate. The dual identity of Kristin Gilbert, a trusted nurse and a cold-blooded killer, left an indelible mark on all who followed the case. The sentencing phase was particularly emotional, with victims' families sharing their grief. The gavel's final strike symbolized the end of a long and painful journey for many. News outlets covered every detail, ensuring the public was aware of the trial's significance. Healthcare professionals reflected on the case, emphasizing the need for better safeguards. Memorials were held for the victims, honoring their memory and the lives they touched. As Gilbert spends her days in prison, the world outside continues to grapple with the implications of her actions. Discussions on healthcare reform have been sparked, aiming to prevent such tragedies in the future. The haunting duality of Kristin Gilbert serves as a stark reminder of the potential for darkness within trusted institutions. The story of Kristin Gilbert is a stark reminder that evil can wear many faces, that even those entrusted with the care of the vulnerable can harbor sinister intentions. Her case serves as a chilling testament to the fragility of trust, the ease with which it can be exploited, and the devastating consequences that follow when those in positions of power abuse their authority. While Gilbert's crimes were ultimately brought to light, her case should serve as a perpetual call for vigilance within the healthcare system and beyond. It is a stark reminder that we must remain ever watchful, questioning inconsistencies, reporting suspicious behavior, and advocating for the safety and well-being of those entrusted to the care of others. Only through unwavering vigilance, a collective commitment to transparency and accountability, can we hope to prevent such tragedies from casting their long shadows upon us again. This vigilance is our best defense. As we reflect on the haunting tale of Kristin Gilbert, we invite you to join the conversation. What are your thoughts on this case? Please like this video and share it with others. Don't forget to comment below with your thoughts. Subscribe and hit the notification bell so you never miss our latest explorations. Thank you for watching. Stay safe, stay informed.